Welcome to Talk Fit. I'm Josh Day, CrossFit Level 3 trainer, head coach here at Leander CrossFit.
And I am Rebecca Remus, owner here of Leander CrossFit, also a level 3 trainer. So
Yeah, she is.
hopefully, yeah.
Yeah, she is.
So this is a funny story. This is take 2 of this particular
Yo,
topic. So
I teased a class about this podcast coming. I was like, y'all are going to really want to listen to it.
Yeah.
And then the audio.
We were on this couch exactly a week ago doing this podcast. And so technical difficulties, we're still learning. Yeah.
I don't even think it was a learning thing. I think it just didn't like what we did.
Yeah.
But that's okay.
That's cool.
Yeah.
Real quick, see what's happened in the past couple weeks. We had our coach meeting, went amazing. We got
Yeah,
some
it was
updated
good.
pictures and cool headshots of our coaches. So our new hoodies have come out.
She didn't get one. You're out of luck.
I know. Well, I don't know if we should
should maybe do another run.
Yeah, I might put it out there as like another pre-order.
Yeah.
That we don't have a bunch sitting
So
around.
I had a few people ask, is
yeah.
there any more? I'm like, whatever's hanging. They're small. And I'm like, well.
Yeah, I'm shocked how many people want a 2XL.
Like a little room in their hoodie.
I know.
I like a large.
I think I may do that, but these are so comfortable. We've only ever done like a black, a gray, or like a navy blue. So Liz came up with this color scheme and I love it. And I've used this thing a lot more than I thought I would. So
the 9:30 class right now is like uniform.
I know.
All in these hoodies, except for Liz today.
Who would have think? Yeah. That group there, I actually have something going on the Rockbot as well. They are ramping up their new season. So if you are at all interested in the folks that participate in the tactical games or shooting competitions, I know Matt Cole does their Sunday just the shooting competitions, but their skirmishes are doing amazing right now. Liz and Wes are talking about the amount of people that have been coming out. So it's like, if you're not sure what tactical games is, it's like CrossFit, but you have a couple of different firearm obstacles as well. I don't want to say obstacle, but you're traveling with some type of firearm, and you're definitely tested on your fitness, but your accuracy with whatever weapon as well. So they run a pretty tight ship out there. If you're interested, reach out to Wes, Mike Rapp, or Liz to see when the next skirmish is coming up. And then I know they have their big dates also for the actual tactical game events, but they have a skirmish like every month. So
yeah, I think they're talking first Saturday of every month.
Yeah,
get with them and make sure. But that's what I heard.
It's fun. Functional movements that they do. I haven't seen anything they're doing like that's gimmicky, and I don't think you can when you put firearms are in the equation. I think they try to keep it reasonable on stuff that you would do or find yourself in. So just making formidable humans, and that's just that's the next step for some people, and just working your fitness here day to day, and then outside the gym just kind of testing in a different atmosphere, which is great camaraderie out there, fun groups. You see some big names also. I think Tulsi Gabbard was at the last skirmish. I don't know how she does it with her entourage of people around her, but you'll see Hepner's still like dominating everybody. Kupa's been out there. Just people that you recognize from the CrossFit space are also dabbling. I don't know if Matt Chan, I think he was doing it, but while his knees recovering, I think he's taking a break. But fun groups. So trying to think of, there was a bunch of us that did the Rudolph 5K last Saturday. That was fun. I'm just a big fan of people meeting outside the gym and just kind of, let's make this fitness like applicable to other things. So we talked about the Hyrox on the last podcast. I'm not going to go too much into that, but fun experience with Kylie. We traveled over to Dallas and got to cheer on a whole bunch of people. Katie and Connor that come to the 515 class did great. It was actually a team of 3 because Katie's got a baby in her belly, and another team out there, Cody and Mighty, so same thing, a team of 3. And we saw.
I'm gonna report them. This is supposed to be team of 2.
I know. You'd be surprised how much the hormones are actually like performance enhancing. So
no, they are. I've seen it.
Connor and Addison were out there. Alyssa, Laura ran a team of doubles females, and it was a team of avatars. It was great movements for them. They did amazing, fun experience. Very not unlike a CrossFit Chipper or a benchmark that we typically do here. So it's benchmarked for us, or workouts that we revisit. So I guess I am a big fan of CrossFit Chippers. So obviously that was something that I enjoyed doing, but now I can come back here and do other chippers and change it up. So you're like it.
Speaking of Avatar, someone just went to Disney World.
Oh my gosh. Yeah. So this was cool. My older sister, I have 2 sisters and a brother, reached out a couple months ago, and my older sister, if you've ever met her, she has a job that you want to punch your guidance counselor over. She manages a group of sellers that sell just things that you would purchase on Etsy, just things that people make that are like whole Disney themed. And she does really well with that. So with that, she gets some cool hookups. I have never heard of anybody visiting Disney as cheap as the trip that me and both my sisters just went on. But oh my gosh, I did not expect. I've always had kind of, I don't want to say an aversion, but anxiety. Because I've always heard about the long lines and the groups, and I know I am in his face. Like, you're mistaken. But, it was. I know. Yes, yeah. And I just kind of, like, my little sister did a post a couple days ago. It was like, I just kind of came to terms with it that I wasn't going to ever go to Disney just because it's too much of a hassle. And there's other places, the family would probably enjoy,
That's
or
fair,
money
yeah.
could go further.
Yeah, absolutely.
But anyways, so we went. I was wrong. We had so much fun.
Yes, she was.
We stayed at the Animal Lodge, so it's kind of cool. You go out, you open up your sliding door, and there's a giraffe hanging out. And so that was just like, I don't know how many times, like, I had tears in my eyes. Like, so you mentioned Avatar. That was on our next to last day. I do not do well with, when we'd go out to sea in my previous life, like, I would have to pop a Dramamine because I would get motion sickness pretty bad the first day underway. And after that, the ship could do whatever it wanted to. As long as I acclimated, but it took me like a good day to do that. Well, I don't have a full day to acclimate. So I did, try a Dramamine that helped out. I didn't need anything on the Avatar ride. I was just like, I don't want to give away too much in case you're about to go to Disney. I want you to be as surprised as I was surprised. Everybody was cool. Nobody did a spoiler, but Jazz, who kind of books trips for people to go to Disney, she knows, she's been there so many times that she knows every single thing you need to. She gave me a list of stuff that I needed to do. I had my son messaging my sisters saying, do not let mom check in out of anything. So yeah, if I had to put, I'm like here with Avatar and Guardians of the Galaxy is like my favorite rides. I know.
Comparison, yeah.
Totally different things, totally different rides.
They're both so good.
What else was there? Rise of the Resistance was also pretty cool.
I feel like it's superior.
You think so out of
I
three?
think it's the best. Yeah, I love it.
So you went with Lakeland last year?
Last September.
The only thing that sticks in my mind is her walking to Belle. That was like my favorite thing of everything that you like showed us.
We'll throw it in the show notes.
I know.
Go to my social media.
I also got to meet Belle, but it was just great. These women are just beautiful. They're flawless. They chose the perfect.
Fantastic.
Yeah.
They just live into who they are.
I don't know if I told you. So the day that we went to Magic Kingdom, they do that parade like at 2 p.m. where the characters all come out. That happened to be our Princess Day. So I had my Pocahontas ears. My little sister was Jasmine. My niece was Snow White. My older sister, so a lot like Leslie, were her Maleficent ears because that's her version of a Disney princess. So we're seated on the curb. And everybody's come out. I think Beauty and the Beast was like the first. Then you had, it's just a whole bunch of Disney princesses. There was Brave, all that stuff. But at some point, there was that big like dragon that comes out, the mechanical dragon. Well, okay. There was the fairies that were, I don't know if they're from St. I don't know, saw my sister and she zeroes in and she's like, you're going to get yours or whatever. And so everybody just keeps noticing my sister with her Maleficent ears. Well, every villain, like including Captain Hook, bow to my sister every time they saw her. She got about 5 different bows. I'll show you the video later, but like the tail, the guy who was managing the tail of the big dragon, like does like this huge show when he sees her. And so like, that's
fun.
I know.
So fun.
What else? I think of all the parks, it's hard. So I think Animal Kingdom was my favorite because of the animals.
The animals are fun.
Yeah. The safari was amazing.
Very cool.
But Epcot has all the good food. It was just
no, you gotta
and Guardians of the Galaxy.
Right?
I know.
Guardians is so good.
I know.
Those are my favorite movies too. So like the Marvel.
So what's your favorite of like all the parks?
That's not really a fair question.
I know.
It's so different.
I know.
As who I am now, having Lakeland, taking her probably Magic Kingdom because like, the castle. Meeting Mickey.
Yeah.
Oh, it was awesome. My favorite thing about her going was like when she learned that she got to hug the characters. That was it. Like we were so worried she's gonna be like a little scared. Like first day she's like kind of learning that she can hug.
Yeah.
And we did a lot of character dining, so they came to your tables and stuff. And they like she'd see Donald and be like, I can hug him. We're like, yeah, when he gets over here, Absolutely. No, I ride wise, probably Hollywood Studios. I like
Yeah.
Hollywood Studios. I think it's fun, like the idea of like being in Hollywood and like
Mhm.
it's neat because like if you know anything about Disney, this is not a Disney podcast, everybody.
I'm so
It's
sorry.
okay. Now, I brought it up. It's on me. Like they keep the magic like hidden and stuff. You don't see anything that's not supposed to be seen.
Yeah.
Cool thing about Hollywood Studios, it's the only park you'll see people walking with their like character bags
Yeah.
through the park because it's a live set.
Yeah.
It's not, it's like background and
I
stuff.
just learned
So
that. That's amazing.
yeah, you're welcome.
Yeah.
Next time you go, well, look, if you see somebody walking with a bunch of black bags, like they are probably a character and they're like going to work. But it's the only one of the parks that you'll see things like that intentionally because
Yeah.
like you're like in Hollywood and you're walking down the streets of Hollywood and you see actors walking. And so that's a fun thing.
Somebody had told me, but I completely forgot. So we were in line to meet Chewbacca
Yes.
near the Millennium Falcon. Somebody told me, I don't know if it was you, that quite a bit of them know sign language. And I saw them talking to a girl. I saw him talking to a girl in
There's some
line.
of the sweetest
Oh
videos.
my God.
If y'all need a good cry,
God.
just
I
go
was
look
like,
up Disney characters sign language.
Yeah.
That's so awesome. The kids' faces when they see that they can do sign language, they like light up because like it's.
Oh, so it was you. It was you that
It
told me.
probably was.
Yeah.
Probably was. It may not have been, but obviously, I've seen Buzz Lightyear, like, and the kids, like, is like Buzz their favorite, and they're like, the kid like kind of signs or like sees that the mom was signing to the kid, and
Yeah.
Buzz like steps in, like, well, I got this,
Oh
and
my-
like, yeah, they're great.
And
It's so cool.
like every picture with me and Chewbacca had tears in my eyes. He saw me and my sister because we all dressed in theme every day. And he
Love
looked at
it.
us and he's like, with his hands, we know, where's my outfit? So I was like, to be a stinker, I was like, can you do like one of these? And he goes like this. It's so cute. So I was like,
I
those
love it.
pictures were good. Who did I hug? Really, I just missed Goofy, and I really only because of that thing that we had with Ashton with the hot dog,
Oh,
and I
man.
really wanted to get and I had just missed him, but that's the first thing I thought. It was like, oh, do the pistols, but he no, I don't play.
That'd be awesome.
I know.
Go to the dance.
Yeah. I don't know. It was just 4 days was it was on, we got up at 6:30 every morning. We didn't make it back to our room until close to 9 p.m. every night. But like that was kind of a quick trip. I know Ashton's going in May and they're there like a good week. So I'm excited for
That's
them.
how we do it. We do a
Yeah.
travel day,
Yeah.
travel day in, 4 to 5 days in the park,
Yeah.
travel day out. Fifth day is like catch the stuff that you didn't get. 'Cause you can't do everything
No.
in a day.
No.
You can't. The parks are too big. There's too much. I love it. I
Everybody's
absolutely
amazing.
love it.
Everybody's in a great mood there. Like well, okay. I will say when it gets to about 6 p.m., you can see the parents that are done.
Oh, yeah.
But
Oh,
like
yeah.
the characters and the staff, everybody's amazing. And there maybe, something happened. Like we all had fast passes. My niece didn't. And they're like, oh, well, she makes 4. Go ahead. Like they're so sweet about being like accommodating and
The magic. They care.
Yeah,
It's so
they
great.
care.
Y'all. If you're nice, if you're rude about it, they will make sure
Yeah.
that, no.
I was wrong. And now it's like,
So when you go back,
I know. And so it's funny. We have a trip coming with the family in August, and yeah, we'll see. We'll see if they want to continue what we had planned to do, because I would love to do that too. But I would love to share this, especially
so
before
great.
Tyler like graduates. I would love to
Yes.
share that whole thing.
That
with
was
him, so.
my parents were like, where do you want to go senior year? Like for senior trip, I said Disney World.
Oh my
That's
gosh.
what I picked.
How much have you been?
So I went when I was 3. I was in a youth choir at my church growing up. We did a magic mystery tour and we ended up at Disney World for a day on that. My senior year, Ariel and I went as our like honeymoon after a couple of years of being married. And then we took Lakeland last year. So 5-ish.
Some people are greedy.
Spread out. That's nothing.
Yeah.
We've got a friend that she has been, I think, like 4 times.
That's
this year,
my older
at
sister.
least,
Yeah.
So it's like they're greedy.
Yeah.
I'm like, I think it'd be fun, but I want the magic each time I go. I think
Mhm.
if you go too regularly,
Yeah.
like it probably doesn't wear off, but I would be like too worried about the magic wearing off. Like, oh, it's just
Yeah.
another theme park. So
Yeah.
I like a good 3 years between each trip is a solid time because then there's new things because they're constantly adding new stuff.
I personally would go over and over on Guardians of the Galaxy because I want to hear a different song every single time I ride
I
that
think
thing.
there's 7. So yeah,
Yeah.
at least 42 times
Oh my
to kind of
gosh.
get all 7,
Oh
right?
my
It's such a good ride. When I went, it was just a virtual queue. Like they hadn't done like the actual queue yet. So like you couldn't just like get in line and like ride it. You had to like at 6 a.m. get on and like join virtual
Oh
queue
my
and then it gave
gosh.
you a time. So yeah, now that there's a real queue, you can like actually do that. It's a
Yeah.
little better, but
The Tron was pretty cool.
Tron is cool.
But now I know the rides I don't want to do. Like, I do whatever you move my body around.
Yeah.
But like when it's a screen, you can tell that it's like oh, my stomach. I just can't. Like, it's not worth it. So I won't do Star Wars tours again.
Star Tours, yeah.
Star Tours, yeah. But I would do Avatar over and over again. Yeah.
So good. We did. When Aaron and I went, it was like the new thing or like honeymoon one. Pro tip, I'm telling everybody, you should know about it, but when park's closing, you can still get in line. Like at park close, get in line for Avatar. Now it's not like the one, but at the time it was like the one that was like
everybody
6-hour wait, like in the middle of the day type of thing. But you get in line at the end and just walk.
See, I think that's my anxiety was like, why would you be in line for like 2 hours and you're only have
you
like
go to something else.
Yeah.
We're not that way.
Well, that's the great thing is my niece was like, hey, we have this thing scheduled. We do have a fast pass for it. Let's squeeze in these two things. And then, it's the food was great. We went to this cool place called Cake Bake for dinner on the boardwalk at Epcot. And I need to show you pictures for that. It's like, I think it just recently opened, but it's like everything is white. And like they had white Christmas trees also, but it was like a place you would bring a princess to go eat. And it's called Cake Bake because all the like it's a bake shop right next to it, but the meals were amazing too. And I mean, just the way they set the setting, like you would think Ratatouille is like running the kitchen in the back. It was just so sweet. Yeah.
Remy was back there. All right, now that we've done that, I did this to us. Maybe we do another podcast where we just talk about Disney, but maybe I cut this and we make 2 podcasts out of it.
I know.
I'll definitely put a time marker, but no, I brought it up.
When the show, and also fast forward to this.
I will. 100%. I'll put it like as the title screen, like jump to this for actual podcast. So why we gathered last week to talk about this cool thing called community care, something CrossFit Medical Society has launched. It's been around for a year now.
Over a year.
It's just been accessible to the coaches. So let's dive into what community care is and why we are talking about it.
Yeah. So we learned about community care. Josh and I went last year to an affiliate summit, and there was a presentation by Dr. Moy, I believe is also maybe affiliate owner, I think, but definitely very active MD.
Yeah, absolutely.
Was going into the way things are managed now. Talked a bit about, Big Pharma and how much of our society has become quite dependent on medication and pill popping to solve problems, right?
Yeah.
Where the solutions that are presented are not really presented in a way to kind of, give you a short duration on whatever said medication is. It's like you're on this medication, you may need to be on it for the rest of your life, which is not really helping people get, I'm going to overstep on saying that. I don't want to say that, but there's a dependency also that I believe that type of management of Big Pharma kind of cultivates. Okay, forgive me because I know it's improved the quality of life of quite a bit of people.
Yeah. I think we can talk about like so Ozempic, GLP-1s.
Right.
He talked about this at that event about how yes, if you're diabetic, there's a place for it. You need that to help you lose weight, and that's great, and that's fine. That's very different.
And they don't vilify,
they don't vilify.
Yeah.
But there is a difference in that and like us going in and be like, I want to lose weight fast, and the doctor prescribing GLP-1s, and he was saying at this time that insurance, Big Pharma, was using this to get you hooked on it, and then was insurance partnered with Big Pharma was going to stop covering it in the next year. And if you all of a sudden can't afford it, a big side effect, if you're not doing it right, where you're working out alongside and like monitoring all the things, you gain back a lot of the weight, which essentially is getting us addicted to this Ozempic thing. Now, this is, I'm not a doctor. I don't know all of this stuff. I'm repeating what I heard and understood.
Right.
I'm not vilifying if you're on it and you're seeing success with that along with working out. That's our goal here is to get us healthy humans.
Right.
But Big Pharma has like 4 or 5 lobbyists per senator or representative on Capitol Hill, which is insane. They're paying so many people to go and lobby so that their stuff can be pushed through, so that they can make more money. Billions. Like the number is like astronomically ugly, almost trillions of dollars that they're making.
Right.
Anyway,
And so like
digressing.
was a psych major, and one of the classes I took was abnormal psychs, and we talked about, not just, there are disorders that, that is what people live with, but there's also parts of the
Yes.
DSM-4. Shit, I think it's DSM-5 now. Oh my gosh, I'm so old.
Just
There
said
are,
numbers at me.
yeah, so it's a manual that kind of lists all the disorders that
Yeah,
people
yeah.
will typically be diagnosed with. And, some of them, can, I don't want to say be solved, but helping people cope with counseling without medication. There are things that you can do as far as like your lifestyle
Yes.
rather than just medicating and becoming dependent on it. So,
Right.
along with like working out, like while what happened in the past like 5 years when we saw like this pandemic, rarely heard recommendations for people to change their lifestyle as well. So it's just, if you want to be conspiracy theorists at all, you could make the case that it is much more profitable for big pharma and insurance companies to keep the population sick and dependent.
Yeah.
It's, you're paying your money to insurance, and they can, keep jacking up these rates. And if you've, gone to any type of, not just a routine, but like emergency room visit, like you have gone through the frustration of, I have insurance, why I have a copay, but then there's other bills will show up as well. Like, oh, this is actually all that your insurance covered. So community, I would say the medical society identified a problem
Yeah.
that we all know about, and came up with a solution. So I've heard of these before, of like
Yeah.
crowdfunding. My family has done a MetaShare kind of crowdfunding when my husband was doing home inspections with a friend of ours. Like his business was still kind of a startup, and so did not have insurance like set up for his employees just yet. So we participated in this, and we're pretty healthy family. So we rarely go on doctor visits anyway, or feel the need to see a doctor regularly. We're really great about our every 6 month dental checkup. Nobody needed glasses for vision or anything like that. So
Nice.
it was fine. But with what they presented, and we're going to now shift over to like the insurance part of it, was an issue with the cost constantly going up quite a bit. With the call that we were on a couple weeks ago, maybe a couple weeks ago, not even a couple weeks ago, with the folks from the Medical Society, when insurance was first introduced as like this concept, what it was meant to be was kind of disaster recovery, right? So your family was in a car accident, or somebody is diagnosed with cancer. You're paying into an insurance that it doesn't cripple your family's finances, right? This is supposed to be, helpful thing to help out. It's going to soften the blow so that you were not too adversely like affected, for years to come. And it's evolved to now the population is sicker than it used to be. Whether it's quality of the food, the plastics in the products that we come into contact with every day, cleaning products, all that stuff is messing with us hormonally, and you're seeing sicknesses that weren't necessarily an issue, or maybe just not like diagnosed or whatever. There's
Yeah.
also that. So now it's become kind of a pre-planned thing where these people are, I am now taking this medication. I don't foresee myself coming off of it for any number of years. So now it's like, that this cost is coming. And so the cost of insurance is actually going up. And so I'll let you talk about the Sousa thing, and like how
Oh
much of
yeah, yeah.
the
There was
insurance.
a great video Rebecca sent to me. We can probably link that to
Mhm.
show notes. If this is your first episode with us, show notes is a little inside joke that we now have them. But he talked about specifically 90 cents of every dollar that you put into your premium for insurance goes to pay for chronic disease. Chronic disease is disease that is preventable, that we have healthy lifestyles and we don't have chronic disease, or you don't have a healthy lifestyle
Yeah.
and you have a chronic disease, most likely. We can fight chronic disease is the point. And
Right.
so you and I, when we pay to insurance,
Mhm.
we're giving 90 cents for every single dollar is going to pay for somebody else to continue to be sick, essentially. Those are my words. 100% true. Maybe they're working towards health and that's great,
Yeah.
but we don't know.
Yeah.
And that's the thing with insurance. Everybody is just giving them money to then go pay for whoever's medical bills. And that's where this cool thing called community care, crowdfunding, health, not
Yes.
insurance.
Not insurance.
It's not
Not
insurance. And we're not selling it.
No.
We're just talking about it to tell you about it if you're interested in it.
Because it may make
We'll get
sense
on
for
that.
you and your family, especially if I think good amount of people just talking with folks in the gym and the coaches, like, are already seeing another uptick in their costs in the
Man,
coming years.
I'll say my number. Those companies covering most of her insurance this next year, I think out of her check is going to come $75. Makes sense for her to be on
Hmm.
that insurance. To add myself and Lakeland, it was going to be $600 a month extra. And we're like,
For what?
right.
You
Because
know, like,
Lakeland is a very healthy kid.
yeah.
We go when she has crazy things like nursemaid elbow that we still don't know how she got. And I go once a year. I have hypothyroidism, and so I have to go get that checked out. See if we need to adjust medicine, things like
Hmm.
that, hormone stuff, right?
Not
So not
worth the
not yeah,
$600.
$600 a month for me to not go to the doctor
Yeah.
for most of the year,
Yeah.
right? Like so for us, why part of why we're here.
So with that cost, and like I said before, the data is not showing that we're putting a dent. Like, we are still getting sicker as a society. So
Yes.
we're
Oh
going
yeah.
to see the costs continue to go up. So what we are trying to do, what the medical society is trying to do, is trying to take us out of that equation, put the power of where our dollar is going back to us. So what the community care is, cost is $60 a month. It's not insurance. You're paying your $60 a month into the crowdfunding.
Yeah,
If you
that's
do
like
have a
you
health
could say a
incident,
membership, if
right,
you
right,
will.
right,
Yeah.
right. If you do have a health incident, or doctor whatever comes up, you'll request to be billed. You take whatever that the bill is, or the incident, you send it over to the folks at community care. Right away, their lawyers, whoever their team, starts negotiating the prices for the cost of whatever that health incident is. So can you explain the fly fishing incident? Yeah.
Yeah, so we had somebody come and talk to us and the coaches. These numbers are not exactly what they said. I'm going to use numbers that just, I remember them being really big.
Hmm.
So, guys out fly fishing in the mountains somewhere is carrying a gun on his chest in a holster because of bears, just in case. You got to be ready.
Yeah.
Bent over something, it wasn't secure like he thought, fell, it went off, and he ended up getting shot because of where he was at. Had to take life flight to a hospital and then hospital stay, all of that stuff. He gets done, gets the bill. We're going to say $1 million. I'm pretty sure they said it was like a million,
Yeah.
close to $1 million bill after all of that stuff. He had not community care, but similar thing, same company, just we're like a subsect of the company from what I understand. But a crowd-funded health supplemental taking care of each other system. So he, with them, $500 deductible, essentially. He paid $500 of his bill. Those lawyers stepped in, went and negotiated the price down, got it down to like 250,000. So half the cost. I know I couldn't negotiate a hospital bill down. They
No.
just, they're like, here's a payment plan
Uh-huh.
for your life and for your children and grandchildren.
Uh-huh.
And then that money, that amount, that bill then gets distributed to the community and people in that community are asked to help cover that cost. Now, you're like, whoa, that divided by a lot of people. There's a max number each month.
Mhm.
For us in community care, it's 140. That's the most you'll be asked to pay a month. And you're asked. You can say no. If you're tight on money, maybe you got laid off that month and you're like, I just can't. That's okay. You can say no. There's a generosity score that could impact if you needed help in the future.
Mhm.
People can see how generous you've been or not been. But out of his pocket, he paid $500 for that $250,000 medical bill because it was covered by the community. From my understanding, no bills, all bills have been covered in the community. When they've gone to the community has funded them. And that's
$500 and whatever $60 membership for this pretty huge, like,
massive.
flying in all that stuff, and then $600 a month for something that he may not use.
And then,
Just
because if I had that insurance and
Yeah.
that was me,
Yeah.
that $600, I'm still paying for life flight.
yes, yeah,
Like I'm gonna have to hit the deductible, whatever it is. It's probably astronomically stupid
Yeah.
because that's how insurance is. And so once I've paid $10,000, now they're gonna step in and they'll pay the rest. Maybe
Yeah.
if everything is coded right and they actually see it fit. This community was like, yep. This happened.
Yeah.
You're a healthy person, and here you go.
Yeah.
So that's the really cool story that I'm like, yeah, this makes complete sense.
Mhm.
Why are we paying this?
yeah. So we had that coaches meeting. I signed on I just have it. I love contributing to it. I still have insurance with my husband. Nothing's happened in the past year for me to use any of it,
Which is
but
great.
It's
And that's the point. Insurance is supposed to be an in case thing.
Yeah.
It's not supposed to be a stressor thing.
Liz, our coach, also signed up for it. So months have gone by. Was it in September? that the
I don't remember. Yeah,
incident
that sounds
happened.
right.
I think in
Yeah.
September it happened. She had an oopsie, and a dumbbell came, fell on her finger, immediate break on her finger. Blood everywhere. It was kind of a big deal. I happened to be nearby, but I got a call that it happened right away. She went to, I think, an urgent care. I don't know if she went to emergency. Either way, and poor thing, was in pain, barely able to get the words out, but was just asking, okay, I have this community care thing. What do I do? Well, I don't have an insurance card. Yeah, you don't need an insurance card. It's not insurance. You just ask to be billed, which is what she did, and then she submitted all her documents to community care. So, not sure where they're at in the process of it, but it was like, talking to her, pretty easy to understand, and
Yeah.
she's not getting things coming out of the woodwork like bill wise. They are at work and negotiating that for her. I think there was something else that popped up for her that she was working on also, but like a different like health event. But it was cool to see it in action for somebody that we know. So that happened, and then we got notification about 3 weeks ago that we were chosen as
Yeah.
one of the first of 20 affiliates.
20.
Yeah, to be able to offer this to our members. So if you're a member of Leander CrossFit, you have this available to you now. This is not available to, the CrossFit population at large
Yeah.
just yet. So this is exciting for so many reasons. Now we had just the affiliate owners that it was available to. So you're talking about the crowdfunding. Now if we're opening it up to paying members of a gym, again, this is our healthy, fit population in the United States. Again, we do not have chronic diseases. But this helps out also with these incidents that pop up with people that are on community care, right? So like this pot of money helps out quite a bit. So maybe you're not going to be pinged as much now, which still, it wasn't really that much at all. I think I got one for like $90. I think I showed you last month,
That's
which
what
is
Liz
like,
was saying. She
yeah.
said, like, if you average across the year what she's paid, it
Mhm.
came out to like maybe $90
Which is still
total.
low.
That's not like 60 and then
Yeah.
also a 90. That's
Right.
like what she paid total.
Yeah. It's
So
just, compare that to the insurance, it's still blowing my mind. Just this is an amazing thing that that team from Medical Society has come up with. It makes perfect sense. And we get to take care of those of us who,
our,
put fitness
yeah.
first, take care of our health, and taking control of what our
Yeah.
families participate in.
'Cause there are people that have chronic disease in
Right.
CrossFit gyms, and that's
Yeah.
okay
Yeah.
because they're here trying to do something about it.
Right.
They're not sitting on the couch just letting insurance pay for it. And
Right.
that's the really real cool thing about community care is
Yes.
started out as just coaches and owners to kind of get the thing running and see how this is going to work. And now they're to a point where they're like, okay, let's see what it looks like to bring community members on, our gym members in. And so you have to have a membership at one of these 20 gyms right now. Hopefully their goal is going to be, if you're an affiliate, you can do this, but like we're kind of in a beta program to see what it's like to bring on members. And so like you can see what this is like as a,
Yeah.
I know, I mean, I'm talking about the cost of mine because it's fresh. We were talking about it.
Mhm.
$600 versus paying for a gym membership. Like if I need to find money to pay for insurance, a lot of people out there are going to drop their gym membership.
Yeah.
This creates that opportunity where it's kind of flipped. You have to be a member of a gym, our gym right now specifically, to be able to be in community care. Instead of having to choose between health insurance that could keep me sick and a gym, I now choose a gym so that I have something to help me.
Which is an amazing
stay
thought.
healthy.
I have a gym membership, and because I have a gym membership, I'm saving so much money
Yes.
every month for
Yeah.
my family.
So it's crazy, crazy
Mhm.
cool. Again, we're not selling it. We want you to know about it.
Yeah.
I think it's cool. I've signed on for this next year to be in the community. I'm really excited to do that, to pay and help people out.
So not only do you have, this thing that you're paying into, there's also some other benefits that are
Yes,
available
yeah.
to you for doing this. I don't have.
So yeah, that
another-
$60
Mhm.
essentially, like I said, membership fee, it gives you access to these things. One of the really, really cool things is the biomarkers
Yes.
blood test.
Mhm.
It would have most insurances wouldn't pay for it or cover this test. So it's like $1,500 to $2,500 if you got all this workout done. It covers one of those annually. Use the sickness, fitness, wellness, or sickness, wellness, fitness continuum to show you where you're at on that. So that if you don't know about the sickness, wellness, fitness continuum, we've done a
Come
disservice.
sit down with me, and I will. Oh my gosh,
man.
my favorite thing.
Go
Yeah.
back and watch one of our podcasts
I know.
too, but it's how we measure our fitness. It's one of the things. So as you are getting healthier, you move across this continuum. So your blood pressure can be somewhere on this continuum. There's certain numbers that will put you in sickness, Some will be well, and then like really, really fit people have a blood pressure of
Right.
insert numbers
You
here.
can throw anything,
Yeah.
your triglycerides, like
Yep.
you said, your blood pressure, what you deadlift, right?
Yep.
So it's like if you can deadlift your body weight, you're kind of on the well part. But if you
Yep.
can deadlift double your body weight, you're more likely a very fit individual. You know, what is your mile time? There's a whole lot. You can
You
just
can
take
put everything on
anything
this
on.
continuum.
Yes.
It's beautiful. Yeah, we'll plug that later. But yes, so that's something that's really cool. There's unlimited talk therapy. I think that's what it's called. Anyway, so mental health is a big thing. It's important.
Mhm.
And a lot of insurances cover part of visits or only so many visits and things like that. With this, we get unlimited talk. We can schedule appointments. We can go and talk to somebody about what's going on up here, what's going on in life, and do that. It's really important to talk to people.
I'm actively right now in
Yeah.
a course right now. So
love
it's
it.
just like you don't realize just the barrier that people put in for themselves to be able to just express their emotions to people. We
Yeah.
just don't.
Yeah,
So
absolutely.
yeah.
24-hour urgent care, virtual calls,
Mhm.
doctor calls. So right there, like you don't even have to go to the doctor anymore. You can get into their stuff. There's doctors in their fancy word for directory. That's the word I was looking for.
Yeah.
They have a doctor's directory that are, most of them do CrossFit, have level 1s and level 2s and level
Or
3s.
own affiliates. Yeah.
Own affiliates.
Yeah.
So like we're continuing to build this awesome community that is CrossFit.
Mhm.
And that's just a few of the amazing things that we get for that $60. There's a big list. We can get that to you, tell you more about that.
Yeah.
But yeah, that
And that's
$60 isn't just like, it's not like insurance where like I'm paying a month and then I still have to pay a copay when I go to the doctor. I paid $60. I can get on a call with a doctor virtually, and they can help me get prescription if I'm sick.
Did you
or
mention the discounted
discount card.
Yeah.
The prescription discount card
Mhm.
that we get. Because again, this is not insurance. Like you'll go to the pharmacy with that.
And we are gonna we are planning on having a Zoom and town
Yes.
hall to field whatever questions that we what we may know, because I guarantee we don't know all of it. Somebody's gonna ask something, so
I'm still going through the training.
yeah. If there's something we don't, so we're gonna be as transparent as we possibly can, and so is the medical society. If there's something that we don't know, we'll put you in touch with somebody who does know. Like there's gonna be questions about pre-existing conditions. I'm not exactly sure about how that will be handled.
Some of those things are like you got to wait a year or so before they'll actually help cover those health events, because everything's tied to a health event and great stuff that we don't need to get into on the podcast.
Yeah. As far as we know, if you are a member at Leander CrossFit,
go
that's
check it out.
Yeah.
CrossFit Medical Society, go to their website. They have great blogs too. Even if you're like, I'm not interested in community care, that's fine. We don't care. But go read their blogs. They've got some great stuff about how to stay healthy and what's going on. And also read about community care. It makes sense to me.
So in line with the way when CrossFit was first birthed, the counterculture of it. This is so in line with that. So
yeah, there's a reason that like the workout is called prescribed, right? It's RX. It's not just RX. It's not just like random. Like, why are we saying RX? Like literally prescription is what that is. Like the prescription for today, how we're going to continue to be healthy is doing this. Like your doctor should be prescribing fitness, should be prescribing CrossFit personally, I believe.
Your gym should have a whiteboard. Your gym should, I'm just saying.
Yeah, but that's why it's RX. Like it's not like it's that counterculture. Like there was like, don't eat sugar, period. That's 100 words of fitness. Don't eat that stuff.
Yeah. So again, we are just trying to divorce ourselves from the sick care.
Yes.
And just putting more power for you and your family so that you can decide what you're going to participate in. So I'm a big fan of that.
Check it out. We'd love to talk to you about it. I mean, we told you why we are on board, but tell you why we're on board.
Yeah.
Like Rebecca said, we're going to do a Zoom town hall type thing, field questions, see if you're interested, and then connect you.
Yeah, if it makes sense for you.
People.
Awesome.
Again, we're not selling it. We just we don't gain anything from this other than you continuing to be healthy and you saving money. Like that's what we gain from this.
I'm sorry. There is a code. I'm so sorry. There is I'll share that with you. I do have that information. So if you're interested, there is a specific link that you'll go through that ties you to Leander CrossFit.
Because you have to be a member.
Yes.
That's the catch, right? Like, where's the catch? You have to be a member.
Yeah, there's going to be a drop down. Where are you a member? And you'll see us listed on there. So cool.
So cool.
I know.
ADHD with Josh. Your HSA and FSA can cover your gym membership too, by the way, if you have one of those.
I have the link for that.
About this, if you need that, let us know.
I think it's still in the newsletter. I don't think I've taken that off.
I just remembered. Like, we hadn't mentioned that in a while. So if you got one of those things and like you put your money to work.
Yeah, awesome.
Yeah, great stuff. I'm so pumped about this. Such a cool thing.
So Awesome. So if you have any questions, let us know. Hopefully we see everybody on Friday night. We have
Yeah.
our Christmas pajama party coming up.
Santa's coming to
I
town.
know. We have, as soon as you come in, we'll have the layout. Everybody's doing potluck style. Please bring food to share with everybody. Our ornaments, actually, let me jump up and
Oh, these are
jump
so
that.
cool.
Where do you
I
put 'em?
love it.
Oh,
Y'all, first Leander CrossFit ornament this year. They've been Grand
check.
Mesa for so long,
I know.
but
So
look
these
at
are going
it.
to be, let me turn, what am I turning?
There
Turning
you go.
this
There
way.
we go.
There we go.
Oh no.
It's come back.
Uh,
Oh, wow. Okay.
you know how we said we have technical
I
difficulties?
know. Oh,
Oh,
there it
there we
is.
go. Okay,
Okay.
camera's back. We're
There
good.
it is. These are going to be all over the Christmas tree that we have here. So you get to pick one off and take one home to put onto your tree. So I know there's a good amount of members that we have now that have, when did we start this? In 2018 or 2019, I want
Okay.
to say, when we started doing the ornaments. We have members that have every single version of that ornaments. We have some karaoke going. Remember, we already have that cool little head piece that we
Oh
can use as
yeah.
microphones. Got some karaoke going, so you're gonna have to fight
You can be
some
Brittany.
kiddos. Yeah, we have to fight it away from Charlotte. So Charlotte's a
Oh,
little
she rocked it
songbird.
last year.
Yeah. We'll have some fun Christmas themed games, but just come in, enjoy each other, celebrate the holiday. Then we'll see you back also in class, obviously, but Christmas Eve, we have our 12 Days of Christmas workout. We have
Love
2
it.
class times. We have a 9 a.m. and 10 a.m. going this year. So the first wave going, first wave may still be going when the second wave stops. No big deal. But we're just, again, enjoying each other and the Christmas holiday with everybody's. Then we'll put out the schedule for New Year's as well.
Yeah.
2027. No, 2026 is almost here.
Well,
2026 is almost here.
2026, just throwing us a whole year ahead.
I know. 2026.
Christmas Day, we're closed.
Mhm.
The day after Christmas, we got 3 classes, 9:30, noon, and 4:30. So we kind of spread them across the day.
Mhm.
People travel and things like that.
Bring your friends and family for
Yeah.
sure for the 12 days of Christmas. Oh, wait, for the party, if anybody is local, bring your family over on Friday night for that party. Everybody's welcome to bring friends and family for 12 days of Christmas. I know we have a lot of people who are traveling. Just let us know. Yeah, just pack these classes and yeah.
Pack them. The Open's coming, 73 days. Registration starts January 14th. If you beat me to register, you won't. But if you do, we'll pay for, maybe we say the second person registered.
Yeah.
Because the first person is going to be me. We'll cover your CrossFit Open shirt. We'll give you that shirt. I thought about a loophole. You can buy gift codes to give to people.
Oh, yeah.
I was like, I guess that's not really registering, because I thought about buying one and being like, I already registered, y'all.
Oh my gosh.
Deal with it. It's not quite a loophole.
No.
Not quite right.
So,
Not in good spirits.
exciting stuff, guys. We're like, to the end of this last quarter of the year, then huge focus on the Open once we hit the first of the year, and your last opportunity to work on some of the we call the goats, or those skills that you still need to progress in. So, because we can guess the movements that we're going to see for the Open.
Just kind of a
and
limited list.
Yeah,
Like at a certain point,
Mhm.
like we know the movements. Yeah.
Quite a bit of the 2026 schedule is already out for the year, as far as like
Yes.
the Open, quarterfinals, a bunch of competitions that we love to support some of our affiliates in town. Iron Bell, usually in the summer. Our folks at Voodoo already have the dates out for their Mardi Gras comp. Yeah, we're gonna do like we always do and show up strong for these events and for each other. So
Yeah.
awesome. Thanks for
Love it.
joining us.
Thanks.